So thanks, everybody. I get the privilege of introducing our exciting speakers today. You probably saw the announcement, but we are flipping the order a little bit so we can get you excited about the applications. So first, let me introduce Andy Larkin. Andy is an assistant professor in senior research, assistant professor senior research. Sorry to mess that up. College of Health. And Andy is in the spatial health lab in the College of Health. He has a BS in chemistry and bioresource research from OSU, and an MS in forensics chemistry from University of Florida, and an MPH from GW, and an MS in computer science from Johns Hopkins, and a PhD in molecular toxicology from OSU. I had to just say all that. He's a great star. He's going to start us off and talk about some of his research on the intersections of environmental epidemiology, new technologies, and big data, and give us some exciting ideas of how we can use GPUs to speed up and innovate health research. Following is going to be Zoe Ryan. Zoe is a solutions architect at NVIDIA, and she's based in San Jose. I can understand why she's staying in San Jose and not coming up to OSU, but we have met her in person. So Zoe is a solutions architect there at NVIDIA, and she works with the higher education institutions. She has been with NVIDIA since 2020, and she's going to talk about some of the technology that is getting set up here at OSU that we're really excited about regarding GPU technology and that we can use in research. So let me turn it over to Andy first. I'm going to hand that to you so you can figure out and send that up.
Thanks. All right. Well, I'm clipping this on. Thank you so much for coming down here today and for representing from so many different departments. We went through just before the presentation. Everyone mentioned the department they're from, and we have quite a few different ones. So thank you for being here, for showing interest. And hopefully, we're going to get you excited about GPUs. So my goal here is to be the appetizer. I'm just going to get you excited about what GPUs can do. Zoe is going to be the real expert talking about NVIDIA and what they're bringing to our campus with the supercomputing center and what that can do for health research topics that are sort of outside of my personal expertise. All right, why don't we get started? So these are the three big topics I'm hoping that we can talk about today. What are GPUs? Is it just an acronym, or is it something special? Why should we, as health researchers and practitioners, care about GPUs? And how do we get started using some of the GPU resources we have here on campus? There we go. Needs a little coffee to wake up, I think. Okay, before we get into details, I'd like to just play a quick quiz game. Let's do man versus machine. So we have some examples here of potential applications. Which do you guys think is better, man or machine? Let's start with medical imaging. Which do you think is better, man or machine, at identifying and diagnosing cancer from medical imagery?
Machine.
Machine? Okay. As just a guess, no right or wrongs. What about looking at imagery and identifying features of the environment?
And see.
Okay. What about looking at drone imagery and identifying people who need help after a disaster?
Both.
I hear both. I hear machine. What about research communication? How many of you have used ChatGPT? How many of you think ChatGPT is better than a scientist at communicating research? Absolutely. Thank you. For all of these, I don't have answers, but I think the real answer is it depends on the details. So I asked ChatGPT, why should health researchers, scientists care about GPUs? And it actually had every single bullet point I have in the slide. And those are, GPUs can speed up our research. we can use GPUs to develop new innovative methods that aren't possible using other technologies. And finally, GPUs can help us push research into action. So that first one, speeding up research. GPUs are built upon this idea of parallel processing, which is something we do all the time. For example, suppose you have a survey that you want to collect from 5 different cities. Well, you could do this yourself, have a long week, go to one city at a time, and collect the data in 5 days. Or you can twist some arms, get 4 people to help you, and finish up the data collection in 1 day. This is basically the idea of parallel processing, using multiple workers at the same time to complete the job faster. And this is what GPUs are built upon, this idea of parallel process. How many of you are familiar with CPUs? All right, lots of hands up. Denise, how would you describe a CPU? What's its purpose?
I just know that it works.
Excellent. It works. It does what we want it to. And there are a bunch of different ways you can define CPU. So that was a very tricky question. The way I would define it for this talk, because I had plenty of time to think about it, is that CPUs complete instructions that we write in computer code. That's the main job of the CPU. GPUs are another piece of hardware, and like CPUs, they are designed to complete instructions in computer code. But unlike a CPU, a GPU has a ton of workers, so it can complete multiple instructions in computer code simultaneously. A CPU, in contrast, if we think about traditional CPUs, they can only perform one computer code instruction at a time. So if you can break down a job into subsets, those subsets can run much faster potentially on GPUs. All right, so here's an example from my research. You're going to see a lot of environmental research in my talks, and Zoe's going to talk about some other exciting areas. And this one is related to environmental epidemiology. In this study, Perry Heistad and I, with our collaborator Mary Willis at Boston University, wanted to compare women who are pregnant and living downwind and upwind of a high-traffic road. So mash those two together and see how the birth outcomes differ when you're downwind versus upwind of the exact same road. So to do this, we had 3.6 million births scattered all across Texas and across 10 years. But to identify downwind and upwind, it's very computationally complex because we want those upwind mothers to not only be upwind of the high traffic road, but all roads. If they're downwind of any other road, they're not a true control. So to look at the wind exposure of all roads within 5 kilometers for this cohort, that would be 567 trillion calculations. And it would take 88 years using the stat server here on campus. Just probably not going to be feasible for a 5-year project. So we reduced that cohort to just those that lived really close to roads. And that would still take about 5 years using the stat server here on campus. So at that point, we thought, well, we can divide this 388,000 cohort subset into groups, into batches, and have each of those workers on the EPU calculate exposures for a different group. And that's what we did. By dividing the data set into sub-batches, instead of 60 months, it took 3 months to do the exposure analysis on our GPUs.
What exactly did you do?
Yeah. So have you ever run a piece of computer code or data analysis in like R where you click on a line of code and run it? Okay, so if you have a CPU, that's what's running the code usually for you. A CPU can only run one line of code at a time. So if you think you have a set of code and it's got to run it on a single analysis one at a time. If you think about it, you could run that same line of code on 4 different computers if you wanted to. And then you could just divide your data set on 4 different computers, run it at the same time, if you wanted to do it that way. And theoretically, it could speed the work process up if you divide your data set into 4 different subsets, had each computer working on it at the same time.
Like, I'm just confused. So is the GPU a graphics? Is that what that's?
So the GPU does stand for graphics, the G in GPU. However, in this case, we are not using them for graphics. We are taking advantage of the architecture and using it for computation instead.
So it's mainly just like complex statistical analyses, making that facilitative.
Yes. So it's like performing multiple calculations at once rather than one calculation at a time.
Okay.
So that's the big advantage of GPUs here. It's going to be essentially running multiple lines of computer code at once rather than one at a time. It just speeds it up.
Now, did you still write that code?
Yes. So I'm not sure if Zoe has it in her presentation, but there are packages. I use a package called CUDA. And what it does is it takes CPU code and you add 1 or 2 lines of extra code and it will transform it so it will divide it for you to run on the GPU. So you have the same line of code, but you add 1 extra line at the very top that says, okay, run this on the GPU. And that line of code will handle dividing up the data set for you and allocating it to the various workers on the GPU for you.
Out of curiosity, you have a personal laptop or computer with a GPU, and you do that same thing in Coda and have your GPU run for you?
Yes. So in my case, I do all of my code writing on my personal computer, which has a GPU. Slightly different, but basically very similar to the GPUs and laptops. So you can run this all locally on your own personal computer rather than in a big workstation if the task is small enough.
Did you modify it to do that? Or do computers come built with that capacity?
So for the GPU computation, if you're running your software in Windows, there are some extra steps you have to do to get the GPU performing computations for research. I think the IT here can help you set that up if that's something you're interested in. And it's also something nowadays you can also go to like Google Colab and run programs for GPUs in the cloud if you don't have to worry about personally identifiable information. Yes.
As a computer engineer, I might be able to clear up some things. First of all, GPU does not do general computing. It's not a CPU. What it does is it computes weighted averages, or mathematicians call them inner products, basically. It does one specific kind of calculation, which was originally done very widely in graphics processing, and which is why it's called a graphics process unit, but it's also used in everything else. It's used all over the place, especially artificial intelligence. And a typical cell phone has a few dozen GPUs built into the processor. We're using to generate the graphics on the screen and stuff like that. So it does a very specific job, but because there are a whole bunch of them in parallel, they can do a lot of stuff at the same time.
Great, thank you. Okay, so that's one way GPUs can help us. It can speed up our analysis. Take an analysis that runs on a CPU, slightly change the code, it'll run faster on a GPU. GPUs are also great at deep. How many of you have created a linear or logistic regression model? Either in class or in research? All right, I'm seeing a lot of hands, great. Well, congratulations. You can put neural network modeler on your CV. Linear or logistic regression model can be created and run using a neuron. For example, here we have this neuron, this blue box. It takes inputs, our predictor variables. It performs a computation, multiplies those predictor variables with the coefficients and adds an intercept, and then produces output. So this is what a neuron is, this blue box computation. Think about all that complexity that went into creating your one blue box. And this is a representation of a deep learning model, where we have many boxes strung together in multiple dimensions that are interconnected so we can capture complex patterns that are very difficult using more simple modeling approaches. Looking at the example on the right here, with 3 of these layers, we start to take an image and we can start to identify features such as faces that I don't think I could ever capture using some of the Bayesian or linear regression models I've created. So this is the power of deep learning. GPUs are really good at this. GPUs can take one of these rows and it can calculate all those boxes simultaneously. So if you think about trying to do this with a traditional one-core CPU, where we have to step through one box at a time, versus a GPU is going to perform these calculations so much faster. And this is why they are such a cornerstone of modern deep learning. All right. So to take some examples of how we in the Spatial Health Lab have been using deep learning models, one example is environmental composition. Looking at images that are systematically collected across large areas, looking at what's stored in those images and extracting the values. Now, these are probably not going to be as accurate as a human labeling these data sets for some things that we might be interested in. But this is a way where we can systematically collect information from large sets very quickly and do it in an objective, reproducible way. So for the Spatial Health Lab, we're very interested in the outdoor environment. But you can also do this with indoor imagery and video if you want to identify people and where they are working, the distance between people and various objects, such as hazards, or if you want to count people and identify their location as they move throughout the environment. Deep learning models can do all of these, and they're all available as open source packages. In the Spatial Health Lab, we're applying these visible estimates of outdoor conditions in the neighborhoods around this Washington State Twins cohort. So we collect images around where people live, look at the grass, trees, cars, and sidewalks in those areas, and see if those conditions are associated with self-reported exercise and mental health. All right, so that's interesting, but that's not really novel, right? I mean, we can get things like environmental composition from other data sets. Well, GPUs and deep learning can also expand and capture new information, and this is where the novelty comes in. So let's go beyond simply capturing what the environmental composition is and get at some features such as perceptions. Based on the broken windows theory, which some of you may have heard of, the environment is not simply what is in the environment. It's also the sociological conditions and how people interact, and that can be reflected in the images and the conditions of the environment visually. So this is what Perry and I have been working on more recently. Here we have 2 different locations, and the environmental composition is nearly identical in these 2 locations. Using deep learning models, we were able to replicate the perceived beauty, relaxation potential, and safety from these images and match it to nearly the same values as what we collected from our survey participants. So we're starting to collect some of these more complex, abstract environmental exposures that traditionally you had to have environmental psychologists perform in-depth surveys and interviews to collect. And we can apply these at a very large scale. So here we applied it to 36 million locations scattered across the US and created these maps for every single public street. So we have estimates of these perceptions, these broken windows sort of features which influence our health, and across every street in the US and across multiple time periods. We're applying this to the nurse's health study, see how these sort of perceptions affect self-reported physical exercise and mental health. So that's one example how using deep learning, we can go beyond what we have been doing so far. Here we're able to go beyond simply measuring the environment, percent trees, percent grass, and try and get these more important abstract features of the environment that we had to have people to measure before.
Yeah, it's one of the benefits of the ability to examine multiple variables at the same time.
Yes, so that is not in this particular deep learning model. This one is more trying to extract features from the images. Got it. And directly identify exposures. However, there are deep learning models which is more traditional to an epi study, where the deep learning model itself tries to predict health outcomes based on exposures. Those are very different deep learning models than what I do, but perhaps Zoe will talk about that. All right. So we had one example where deep learning models can help us innovate. We had one example where GPUs can help us speed up our workflow. Lastly, I'd like to think about how all these GPU resources that we're getting on campus can help us transition our work from research to actually creating products that can be useful for policy and for interventions. So we have an enormous amount of GPU resources now here on campus. When Perry and I built our workstation 5 years ago, it took that wind exposure analysis I was talking about, sped it up into 3 months. With the resources we have now, that we have access to the DGX server, it would take less than 1 day. It would actually take about 18 hours. So if you think...
Just want to clarify. So it took 3 months to run the job.
Yes. And that's using our custom workstation, which it consists of 6 3090 RTX GPUs.
When we're considering the new systems we're building or processing units we're building, are we doing it in a way, I guess, what are the ways we're doing it so that it's future-proof if they are improving so quickly?
Yes.
Imagine we want upgradability.
Yes, absolutely. If you think about the DGX server, when it went in, God, I'm getting old here, a while ago, that's when I'll say it's back when I was postdocing. That sort of clouds my age a bit. Back then, they were saying this is the newest thing. It's going to help this college for decades, and it has been an enormous resource. Now they're saying we need to build a new supercomputing center because GPU research, deep learning research is moving so fast, the hardware and the software, that we need to build an entirely new center. So Zoe is going to be a great person to talk to about how NVIDIA is trying to work with OSU and ensure that this new supercomputing center will be upgradable and future-proof. But I am more of a software person, so Zoe is definitely the person to talk to about the hardware aspects. Yes.
You explain the difference for us between a GPU solution that gave you 3 months, right, runtime versus the GGX.
Yes, absolutely. So when Clara and I started working with GPUs, we found that we were unable to access a really high performance server like the server available in DGX. So we built our own workstation. These are using computer cards like those you'll often find in high performance desktop computers, rather than the super high performance GPUs that are in supercomputing centers like DGX. However, using liquid cooling, which we actually built these systems ourselves by bending the pipes using heat guns ourselves, we were actually able to overclock the 3090 GPUs and get them to within about 40% of the performance of these supercomputing GPUs. So our workstation is about, it's old. That's the big problem here. It's old, but back in its heyday, it was equivalent to about 40% of the allocation you could have gotten if you were an engineering professor accessing the GTX. So the big take-home message is we got some powerful stuff coming in. We now have access to it. Resources have recently opened up in the DGX server, and we also have this new supercomputing center coming in. And it lets us perform research really quickly. And I think because there's so much power here, rather than just simply speeding things up, we can also think big. My first thought was, well, why don't we expand back to the entire cohort, generate exposure estimates there? But I think we can do even better. Why don't we expand to every building in the US? Calculate the hours downwind from traffic for every building. make that product available to everyone, every air pollution epidemiologist. That's something we can do. But I think an even better step is to think big action, not just how this can improve research, but how this can improve products that we can give to policymakers and to people who are considering intervention. So the final example I'd like to talk about is a project we've been doing in Aspire, which focuses on children's environmental health. And here we're looking at social media. Social media, for better or for worse, is a place where a lot of people get their information. Some of that information is correct, and some of it might not be so correct. It's also a place where a lot of people express needs, perceived risks, and concerns. And a lot of that information is publicly available. So we collected 650 million posts, social media posts across a decade from 23 billion users across the US. And we wanted to see, what are people talking about with respect to children's environmental health? We developed these deep learning models to look at the text and the images and extract information from them, such as the age groups of the children, the places where children were spending time or people were concerned about children spending time, and the health conditions and perceived symptoms that were reported in the posts. And one thing that's really cool about deep learning models is that they can take multiple types of data into a single model. Like here we have images and text. I'm also seeing examples of Fitbit with electronic health records merged into a single model. It's really cool. It has power to do that. Another way we're looking at this data set is as a network. So misinformation often spreads from one person to another. It's not contained within a single post. To do this, we need to look at our social media data set from a network perspective. Now, our network has 32 million users. That's a big network. It's hard to analyze that and extract meaningful information if you're a human. If you're a GPU, you can do this in less than 5 minutes. We were able to identify more than 100,000 communities from this data set. We're talking about children's environmental health in less than 5 minutes. We initially tried to do this on a CPU, and after we had more than 3 days without identifying a single community, we switched to GPUs. So it's another great example where GPUs are essential when you're working with these huge data sets to perform these sort of analyses in a meaningful amount of time. And for us, this is really important because viral messages propagate so quickly. We can't wait years to retrospectively look at this and identify people were talking about COVID incorrectly 3 years ago. That's not going to help us today. But this is where GPUs help us transform this research we're doing now and put it into action. There are billions of posts about environmental health conditions on social media every day, way too much for any organization, even huge ones, to analyze the humans. We really need computers to make this happen, and GPUs let us do that. With GPUs, we can take these models we're developing, identifying needs, risks, and misinformation in real time, and respond in minutes to these posts. Hand them over to people who specialize in communication so they know where they need to talk and intervene to help people get the correct information. And that can only happen with GPUs. All right. So that is my take on GPUs and why we should care. That's sort of my box. Zoe is definitely the person you're going to want to go to if you are more interested in what are GPUs and how to get started, because she's a rock star on those topics. And I believe Zoe is up next.
No, great. Thanks. Start sharing. Tough act to follow, I will say. All right. It looks like everyone is seeing my slides from what I can tell. Again, my name is Zoe Ryan. I apologize I'm not there in person with y'all, but look forward to hopefully being on campus with you a little bit more in the future. But like mentioned from both from the introductions and from Andy, I'm a solutions architect at NVIDIA, and my primary role is supporting y'all and trying to decrease the time to science is our kind of main goal. whatever you're working on, we want to accelerate it so you can get to new insights faster. That's really kind of my task at the end of the day, and it can take many forms. And today we're going to talk about not only what we see from our own research teams who are working in the health space, but also what we provide as part of a software platform and ecosystem for the type of things that you all might be interested in. So really, it's going to be a broadly reaching talk with hopefully just some ways to get you feeling inspired and excited about trying out maybe some of these tools in your own research. And so without hopefully boring folks too much, Andy's already done a really great job describing literally what is a GPU, what is it, what are we getting? I just want to take the one or two nerdy tech slides just to kind of hopefully nail the point here as well. So when we think about what we're doing on a day-to-day basis, I'm using my Mac. I know it has a good CPU in it, right? Because things like my email work well, my PowerPoint presentations work well. All these tasks are very well optimized to go one after another. Kind of like when I give myself a to-do list, I'm usually trying to work down in order to get through all the tasks. And what our computers that we usually work on are really good at is getting through these very fast. But kind of what happened late 90s, early 90s is folks realized you can do things like rendering images much faster if you have many workers that can be doing things at the same time. So the kind of like cliche drawing we're looking at here, right, is we have these little boxes that are workers on our CPU. It does things in order, it does them really fast. And then what we introduce on the GPU is millions more workers to get the job done. So at the end of the day, the combination of these two pieces of hardware are what unlocks really fast performance for us. So we can continue to do things that are sequential in nature on the CPU. And then we get this kind of workhorse processor that can crunch through numbers very fast, whether that's big matrix multiplications, things that are independent but could be done at the same time. So high level, what is different? We're providing many workers to do one job at the same time in a GPU. And the cool thing is, right, this isn't a complete overhaul of all the types of work that you're already doing on your computer. If you think about the types of things Andy was talking about, or some of the other examples we'll talk about today, there's usually one or two sticking points where you have a massive amount of computation that needs to be done. And the GPU is a great place to offload that work while continuing to work on your CPU as well, right? So if this is too much in the weeds, all we really want to think about today is ways in which we can take advantage of the parallel nature of this hardware in order to do your research faster. And so we'll get out of the hardware slides and hopefully talk about things that are more relevant to the research you all are doing. I'll be candid, I am not an expert in the healthcare field, so I apologize for misspeaking if I'm mislabeling or misrepresenting some of the work you all are doing, but my expertise is much more on the side of taking workloads, kind of wherever they come from, and helping run them faster, right? So these are some of the tools and areas that we're spending a lot of time on, specifically in the healthcare field. So we have a couple categories we're going to talk about today. The first is Clara, which is our platform that is for, broadly speaking, life science and healthcare. And when I'm talking about platforms, what I really mean is, it was asked earlier, kind of what are you literally changing in your code from running it on your laptop versus running it on your workstation? And these platforms that we're going to talk about today, mainly Clara, are software that's already written to run on the GPU. So its goal is to alleviate some of the pain of potentially having to change code or write your own code, but instead provide you with a solution that you can plug your data into and utilize it kind of as a software piece instead. And then we're going to talk about workloads a little bit. Medical imaging was kind of the first example we talked about at the beginning. We'll talk about ways in which GPUs can accelerate medical imaging and also work being done on medical devices. We'll talk a little bit about biopharma and genomics, and then kind of next steps. Why do we care? How do we get started? What does this change about your day-to-day potentially? We already talked a little bit about like why do we care? Why are in this room and here online are we all trying to learn about AI, accelerating our research and using this big kind of gold hunk of metal, which is kind of what this looks like. I think this is actually the University of Florida system. And the main reason I wanted to put up this slide is that in the next 2 years or so, Oregon State is going to have one of the best and fastest supercomputers that a public university could have. And so it's basically unlocking an amount of compute that we at NVIDIA don't have access to, right? So the goal here is that by the time you all get access to this world-leading hardware, you know exactly the type of things you would want to run on it, right? So we've seen some really great examples of scaling, how we can think bigger, think about larger populations, think about bigger data sets. And kind of the main goal here is just to stoke the interest about what's the biggest problem we could think about tackling? What are the things that previously I dreamt about trying to solve, but couldn't think of a way to do that without requiring like tons of individual folks going out and collecting the data and analyzing by hand. The goal here really is to dream big, right? And then the next steps we can take are figuring out how we actually can accomplish those. So I wanted to just highlight 2 projects that were kind of indicative of the type of thing that can change when you have this massive amounts of compute available to you. So University of Florida, I guess 2 or 3 years ago, got a supercomputer as well on their campus. A super quad is what we call it. So basically what they got was an older version of the type of system y'all will be getting in the next 2 years or so. And one main project came out of this immediately. From the healthcare researchers at University of Florida, this first paper here is highlighting their Gatortron project, which at the time of its release was the largest clinical language model in existence. It was trained on 2 million patients, so they were able to scale to a size that they had not yet gotten to. And it basically took advantage of all their electronic health record systems. They were doing some processing on this massive amount of de-identified data that they had access to, but didn't know what to do with. And so they had this model that was trained on a size they had never seen in the healthcare space. And even with all the resources, training this model took around 6 days on 80 GPUs. So this is the type of scale of thing we're talking about that Oregon State will also have eventually, right? This is 124 of those nodes that Andy was talking about. So if you think about the scaling from a single workstation under your desk, even if it's heavily modded, all the way up to a system that's around 1,000 GPUs, that's how you get into the territory of research that is a new scale, right? A bigger scale than we'd seen before. And it's continued, right? They've continued this research with what they have available to them. And they were able to, I guess, at the end of last year, use the same hardware. Actually, only half of it was needed to train this GPT version of it. So something that's using a large language model like we see with ChatGPT. It's the same underlying model. And they instead added on here 82 billion, I had to write the number down, I don't want to forget, 82 billion words from de-identified clinical notes. And they're able to now generate some new synthetic data that's in the format of this electronic health record. So while the details of this are maybe not the most important part, I really just wanted to drive home the point that this is not research that UF was thinking about doing prior to getting this system, right? That mindset shift of saying, hey, I have 100 DGX stations I can take advantage of. How big can we go? So this has been a collaboration that's been long-standing now with UF, and it's great to see how big some of their researchers in this field have gotten to expand as far as their existing work. So now, is there questions in the room? Also, I'm happy to take them. I know it's a little bit awkward with, yeah, okay, I can see hands. Yeah.
I'm curious. Oh, can she hear me?
I can hear you.
I'm curious. So you mentioned 80 GPUs took 6 days to do that at Florida, the first analysis. We have an idea of the number of days it would take AGP Links to do it with the platform being built here?
That's a great question. So yeah, this hits a little bit to the question around how do we stay relevant with this hardware, right? And so these A100s were, at the time that this was installed, University of Florida was the only major system of these GPUs. So they were brand new at the time. We've since had a whole nother generation of H100s with, you'll actually have some on campus. I'm going to talk about that at the end. And by the time that you get this system installed, we'll be looking at something called R100 probably. And just for reference, what we expect most of the time is a 2x speed up year to year or generation to generation for GPUs. So from A100 to H100, roughly a 2 to 2.5 times speed up. And we'll see about the next ones. So while I don't have an exact guess, I would say similar nodes, it would probably be like 3 to 4 days now. And just for reference, it would not be possible in our lifetimes to run this on any amount of CPUs, right? So it's not a comparison of, oh, I don't really have the time to wait. It's you can't get it done if you don't have GPUs. So that's a rough estimate, but the system you will be getting is much more powerful than the original system at University of Florida.
you say doubling every year. So is that faster than Moore's law estimate, or?
Yeah, it is. So there's now this, I guess, joke in the industry around Moore's law is dead, and it's Jensen Huang's law now around the scaling of GPUs. Seems unattainable to keep up, right? But that is kind of a joke, a little tongue in cheek, but also, yeah, Moore's law is no longer kind of the most relevant thing for GPU scaling. It's becoming more unpredictable because our architectures are also changing, but yeah, that's a great question. You look like there's maybe another hand. Yeah, go ahead.
So the system you're getting at OSU will be housed at OSU, but the servers are not technical. Are they also housed at OSU? Can we upload any data, or is it like we only upload the identified data because the servers are not necessarily protected by the OSU firewall or something like that?
Yeah, this is a really great question. So the actual supercomputer will be located on your campus. And I actually think I saw Mark Heber on here as well, but I don't specifically know about what you all will have in terms of storage for patient data. University of Florida does have a system that is in compliance with the regulations required to house that type of data. And I think that's been in conversation here as well. But the more that we have questions about it, the more we can advocate for it as the official plans come into view. So in theory, if it's not patient data, if you have normal data, there will be massive amounts of storage with this supercomputer where you can go ahead and store things that you're working on as well. So broadly speaking, it will be in the CIC. It will be physically on campus. There will be a lot of storage. And the plans around handling whether or not it will be able to handle patient data are definitely still in motion, and still something, at least as far as I know, right? A conversation that's being had. But yeah, the servers will be behind a fancy glass wall in the new building, so available for people to see. Are there other questions? I know I can't see the full room, so those were the only two hands I could see.
Sorry.
Okay. Okay, great. We'll continue on, and just hopefully now we're going to just roll into what are some exciting ideas that we're working on at NVIDIA, we're working with folks in industry on. And Clara was a platform, broadly speaking, that we put together to try to help address most of the facets of healthcare and health research. So we had some major categories where we saw, hey, CPUs aren't really keeping up with the pace that we need these developments to happen in. So things like medical imaging, the medical devices, doing drug discovery, genomics, and digital health are all big areas of focus inside of this one platform. And then the bottom portion here shows what products or what software pieces we've put together to run on the GPU that do this really well. So we're going to go ahead and talk about medical devices and medical imaging first. And I feel like I'm a little bit now entering into imposter territory, but thinking about the types of data that you all have is kind of one of the most exciting things for me personally, right? Colleges at Oregon State have consistently come up and said oh yeah, we're working with this massive data set. And those are the types of things that are great for the GPU, right? The GPU crunches through image data, text data, chart data, it crunches through that data so fast that we can get new insights at a pace that maybe was not feasible before. So throughout this kind of journey as a patient, there's tons of data that's being generated. And if we're able to kind of use this in a way that is also protecting the patient, but also is allowing us new insights. That's kind of our main goal. And so we want to connect not only with the medical devices, but all the types of imagery that are outcoming. And so we have an example here, and I actually got to work on this project when we were doing it originally back 2 years ago. And this is a simulation environment where we're trying to do, I forget the name, it's not tongs, tool detection in a surgery center. So we built this virtual environment. We're using training data. We're getting images out of it so that in real time, we can actually get the outline of the tongs in our surgery, right? So it's not just a culmination of using existing data. You can generate new data, and it allows you to do things like build out this entire process to take in our inputs, do some conversions under the hood, right? Figure out what our actual tools are in the scene, and then have them segmented out in our picture at the end. So the goal for this was to do some tracking during real surgeries of where the tools were moving. And so we were able to create this virtual scene to do that without actually having to go and be invasive in creating or collecting training data during actual surgeries. So an example, and then we also have, in the same vein, what came out of this is, and this is kind of, maybe you all are more desensitized than I am to this. This slide is a little bit gross for me, but what we have then is the opportunity to collect tons of this data and provide it for folks like you to use, right? So we have collected data for all different types of surgeries where you can do tool tracking. For example, this is the one we were just seeing. This is now in a real surgery. We can track tools during an endoscopy. We can segment out different pieces during a colonoscopy. And we can even look at ultrasound as well. So what's most important on this slide is that we're focusing on trying to build out models that you can go ahead and use towards your own use cases, whether the data is coming from ultrasounds, endoscopies, images from ultrasounds. All of these are massive amounts of data that we're trying to have models prepared and ready for you to use. And so when we're talking about models, what we're really talking about is the pieces of software that are allowing you to take in the data and extract some new insight, whether that's segmenting out the pieces in the colonoscopy that you want to look at or segmenting out the tools as well, right? So model at a high level is just take in your data, it's trained, it's tuned to do some specific task, and at the end, you're gaining a new insight. And so part of that is actually something called MONI. And this actually is not an NVIDIA specific product. And so it might be something y'all have heard of. MONI stands for Medical Open Network for AI. And so it's a huge contingency of folks across research, across academia, across industry, working on actually kind of accelerating the field of medical imaging. And they have a bunch of different workloads that they've made open source. That's a huge key for us. It's making sure that what we have available is available for you all to use. And so with this toolkit, they've GPU accelerated tons of different workloads. AI-assisted annotation is one that I hadn't really thought about, but it's a great kind of time saver, right? If the AI can successfully do some of the labeling for you, that can speed up a lot of processes. And they also have all the way to the end of the pipeline where they can deploy into hospital infrastructure as well. And I know I'm moving along a little bit fast. I kind of just wanted to get some ideas out. And I know we have just a little bit of time left, but with MONI, they also have all of these different data and modalities available for folks to use, right? So they have models for things like X-rays, MRs, CTs, all from radiology, and they also have different modalities for the other applications as well. So really what we are looking at here is a wealth of data and pre-trained models that can help you get to some new knowledge about your own data, right? Maybe you have a lot of MRI data or mammography data and you're looking to extract some new insights. These are the types of tools that can be used to do that. So examples of things you might want to do would be these detection models where you're looking for specific areas or holes in this section. It could be doing classification of the way these different X-rays look. These are some ideas and partners of MONI. Okay, biopharma. So this is obvious. I mean, maybe this is a little bit too timely, I guess, with the announcement of the Nobel Prizes recently, but one area of focus for NVIDIA has been around accelerating drug discovery. And we have actually, so these are just talking about how the ecosystem of drug discovery has massively changed since around 2020. People are now using all these different types of techniques to alter and work with our traditional molecular dynamics workloads and being able to design these new molecules with specific characteristics is kind of a new field that's really contingent and dependent on having GPUs. And so BioNemo is just a framework that we have for collecting all of these models, right? It's an AI platform focused mainly on drug discovery, where you can bring in your own data, your own models, and utilize kind of the acceleration pieces that we provide. So this is where I'm sure, butcher some of these examples. But some of the ones that I think are cool that we have examples for online is DiffDoc, for example. So it's diffusion-based, which is mainly meaning that you're generating new content. It's kind of like when you go online and you're using a diffusion model you put in some text and it generates an image. It's the same underlying structure. And basically the goal of DiffDoc is to predict where on a small molecule you can do your actual docking. And so it's able to generate the potential docking positions on the molecule with some information about how likely they are. So that's one example of the way in which you can use GPUs to create new insights. Coming soon here means like these are examples of things that we have online, and I'll show you where you can get access. And I guess one of the other ones I wanted to mention briefly is this ESM1 and ESM2. Those are kind of the original pieces of BioNemo. And their focus is on a large language model, so like a ChatGPT style model, but specifically for amino acid sequences. And so the goal here is that with this model, we can generate different representations for a ton of different proteins, where they have different properties and where their function is also something that we're predicting in that process. So we'll show examples at the end. I have a link for y'all to try them out, but I just wanted to highlight some of the other areas where we're focusing. And drug discovery is kind of one of the things that's grown a lot for us as far as we're working with partners. University of Florida has the example here. This is the same Gatortron example. They're working with us on the BioNemo framework, but then we're also working with research institutions and large companies. All of them are employing BioNemo to do their different drug discovery research. And it's an open source platform for folks to get access to. And we're going to kind of skip along here pretty fast. I want to leave time for questions, but the next category I wanted to, or do people have questions? It might be more relevant to just take questions rather than try to hurry through.
One online one.
Right. Feels like
that is any databases about current medications.
That's a good question. We could ask. So we have a colleague on my team. Her name is Huiwen Zhu, and she focuses specifically on healthcare and healthcare research. And so she'd be a great person to follow up with for those domain-specific questions. So I'm happy to ask her. Yeah. The last category I wanted to talk about was just genomics, right? We're trying to hit just big categories of interest. And I think one thing that Andy was discussing and that I think comes up quite a bit is just that the amount of data, regardless of what industry you're in, is growing at a rate that's almost kind of incomprehensible, right? And so with this kind of accelerated compute, the goal is not only to drive costs down of doing things like sequencing, but also just to be able to do more of this and to do it faster, right? So a good example of that is for Parabricks, which is software that we're focusing on mainly doing the secondary analysis of both RNA and DNA sequences, hoping to help researchers analyze the whole human genome. And they're actually able to do this now in under 30 minutes, which is a huge improvement based on traditional CPU strategies. So again, I know we're kind of in the weeds with some of these things now, but I just really wanted to highlight that the domains that y'all are hopefully interested in have a lot of support around software that is already GPU accelerated, right? The onus is not completely on you to go out and develop these new softwares. If you're not a computer scientist, there's tons of things out there that are targeting specifically researchers who are looking to decrease their time to science, right? Their time to solution. Parabricks is one of those tools that is pretty popular among researchers that we've been working with. I guess Stanford is one of the original groups that we're working with. Parabricks, they're definitely focusing on doing DNA sequencing, but also just getting their time down for being able to provide those types of answers. And we do have a global team as well. So we're doing collaborations and work with universities kind of across the globe. And Parabricks is one of those ways in which we're actually focusing in on what researchers are interested in doing. And so now I've blabbed on for a long time, right? You've heard a lot of names, types of work, ways in which the GPU might be useful. And the leftover question is, how do we get started today, or what can we get started on today? And the first thing I want to mention, and we can, I guess, send these slides out as well, is that a lot of these models, specifically the ones in BioNemo around drug discovery, you are available online for you to try out. So if something really resonated on the kind of BioNemo drug discovery protein design docking slides, we have this page called ai.nvidia.com. Oh, it's actually called I think it's ai.nvidia.com. I could pull it up afterwards, where you can try out these models online. So it's kind of like ChatGPT, but for trying out these different types of models. And then the last thing that I wanted to leave you with is that although the CIC is not built with a supercomputer yet, Oregon State has done a good job of getting more compute on the premises for y'all to use. And so this is the page that you can get links to for getting access to things like H100s and Grace Hoppers on campus. It's on the engineering page, but it is a resource available for anyone in Oregon State. They've actually even let me get onto the system. So I'm happy to help folks who are interested in potentially trying out the compute that you all have already. But the goal here, again, right, is just thinking about what you can do currently and then scaling it out to match the amount of hardware that you're looking at having in the future. So I know we have very little time left, but I would love to hear more questions. And I thank you all for coming and listening to both Andy and I talk. It's going to be really exciting to see the type of work that you all are able to do on this system when it's brought up. So I left my email as well. Feel free to reach out and ask questions. I'm happy to brainstorm or chat about any of your interests for potential research.
And so I don't give up. Now there were some questions. So when you said there are models that you have that you already trained on a lot of data, does it mean does it come like our package where we have the model and we use our data and we can run that model and check if it works? Or is it like just something we can see and maybe license from NVIDIA, or how does it work?
Yeah, that's a really good question. So when we're talking about like model usage in general, there's kind of two main categories of things you're doing. Training would be the first. And so what we do at NVIDIA and what a bunch of people do is they take in tons of data and they do the heavy lift of training this model. What you all are focused on in that case would be getting inference out of it, getting answers. So it's kind of like someone out there trained ChatGPT. They changed GPT chat. They trained GPT-3. We all just want answers from it. And so we provide these models as like a package, sort of, like a container that you can download and get access to. And you can get answers from it by plugging in your own data. You can also take them, though, and add in, maybe you have a specific area of a CT scan you're really focused on. You can take it in and do what we call fine tuning on the model, where you can have it more steered towards your specific task. But we do have them all available on a page called ngc.nvidia.com, and I can send these as a follow-up. That's where you can get access to tons of open source models.
Thank you.
Just we'll let you run the models.
No questions. Right. I just want to say that if we can have more workshops, which on specific topics, if people are interested. And Zoe's, I think, available. I haven't talked to Andy, but anyway, I would suggest that if you would like a workshop on a particular topic or topics, please let me know, and I could help arrange that. And Zoe, it's good to see you. I wish you could be here.
Yes, next time, hopefully. Yeah.
Are we good, or do we have time for any more questions?
Was wondering if Zoe's okay staying on in case people want more questions.
Yeah, I have another call coming up, but I could stay on and answer a couple questions if folks have them.
Yeah, I guess we can go on people need you. Well, I have a question. You know, I feel like with my research team, I said, a lot on the getting ready, so then I did some large data sets, we're in a amount of time doing joins, doing segmentation. Are there tools in there that do the data management for you, or only the analysis?
Yeah, that's a really good question. I think most of the time when we're talking to people who are doing like data science, even if they don't consider themselves a data scientist, you all are doing that work. The most painful process they refer to is ETL. So like the operations of loading in, cleaning your data, getting it in the right structures, all those pieces. And while we don't necessarily have tools that like automatically will do that for you, we have libraries that accelerate that process, right? So we can do some amount of pruning and cleaning with the data. If you all are familiar with pandas, is anyone here a Python user? We have a data science, data analytics tool that's a GPU accelerated version of those. So it just takes in data, helps you clean it up before actually going to training. So the goal is to have something that addresses every stage of the process. So there are some tools there that I would definitely be happy to look at the data that you all have and see if it would line up with the libraries we have as well.
Thanks. Go ahead.
Yeah, so Andy was really giving a really great example, right? How with the power of GPU, right, the compute time really goes down, but at the same time, he is replying with getting more data in it, right? And people way more data hungry. So my question is, from an interest, right, from all the researchers here at OSU, what kind of data are you actually working with? What are you envisioning using? What kind of storage needs we actually are going to have? When somebody asked that question, are we thinking just about compute, but we also think about storage? And we're actually thinking about that at OSU, but we need to have insight in what kind of data sets are really here that we want to apply to that big supercomputer that comes into you.
So here's another example. Health insurance claims data. Pushing, a lot of Zoe's examples also have protected health information in them too, but so there's that dimension. But they also have, long rows of data and millions of rows. Um, we can do simple things like logistic regression and survival analysis. But where it really becomes challenging with any resources that we found here is when you want to do bootstrapping or sensitivity analysis or nested sequential clinical trials. I've had my students stop doing their work because they don't have weeks to run jobs, for doing areas such to. So that's one example.
I have a follow-up question to that, which is, what is the timeline that we're working on? Because we can dream big, but many, like we said, often we hit the barrier before we can execute. So do we have 2 years to do this, or is it 6 months? Give us the timeline. We will fill it.
Well, I mean, that's an interesting question, right? So you can back calculate, right? When the supercomputer will come, say, in 2 years. The system needs to be procured, it needs to be installed. And basically, within probably the next 6 months, we need to have our answers about what kind of usage we see at this particular supercomputer, what kind of storage needs we need. So we can actually be ready 2 years from now when the supercomputer arrives. So it's sooner than you think. So
is that going to be allocated college pieces, or is this
very good questions, all still to be determined how they will work. Yeah.
So if I was writing a grant that's due in December,
exactly?
But I talk about this, or is it too soon? A grant that would, if magic happens and it gets funded to start like September of 25, this resource isn't available yet, right?
Yep.
Exactly. And are we going to get caught then?
But it will be early in your grant. But your R1 year 2, it's available. And
it's untested though. 5 year, you probably have.
Right.
Those are just kind of practical, logistical questions that we have, because if you do want us to start right, and big grants of 3 times a year.
I also wanted to say it'd be helpful to have some checks using grant applications and who I go to for that.
Well, but we're working on it. No, it's nothing maybe. We're working on that. And it's a very important. Are you in conversation with folks from Florida who are some years ahead of us now about how they manage the gap between, the period where you're getting ready and the time to its arrival? And some of these practical questions probably we can learn lessons directly with them. And we're all being worked on, but it's a lot of different things. University of Florida, it's actually quite different from how Oregon State is being structured and how they actually set up the research computing enterprise. So it's not necessarily directly translatable, but of course there's lots of lessons to be learned. Yes. Thank you. So I think a good place to start might be taking Matt's project, for example. So Matt is doing some noise sampling collecting in Portland. And I think his project is really a good example of, we know what data type he's collecting. It's raw audio. We know approximately how much space that would take at his current sample size. Matt could say, if I dream big, and this is how much it might increase if I have access to the supercomputing center. So using those sort of projects as an example, where we know the data type, we know how much space it will take at the current size, we could take that and project what the future applications might be once we can start getting funding with this resource we can leverage.
That would be quite helpful to know that kind of projections. Yes.
So did say Shannon never called us.
We're tended to with Surge, I'm not the processor will be dedicated to origin. It sounds like we can ask big questions that take some time to process and then take away processing power from other people. How does that work?
Yes, that is a very good question. How these forces will be allocated. Good. I think that's a good question. And I would encourage everyone here who is interested in GPUs, who even if they think, there's an outside chance they might be using them, speak up. Let people know that the College of Health really wants access, equitable access.
Yes.
In the upcoming supercomputing center.
Yes.
I had a quick note, really quick. Sorry to interrupt from the big screen. I had mentioned Mark Keever, and he thankfully emailed me while I was talking to give a little clarification that they are looking at high trust framework, or a framework like high trust. So he says they expect to be able to use HIPAA data on the system at this point, but they just don't have the details yet. So that's from Mark Keever, and I think he'll be your best point of contact for those specific questions. But I just wanted to throw that clarification in. We could reach out.
Helpful. Thank you, sir. Any other questions? Thank our speakers again.
Yes.
Well, Stan's asking a lot of questions around how to get rid So maybe I'll figure out more, because it seems to me that in things I want us to be visibly into use of space, and I need to know what we need to do to do that. We're talking about what kind of storage we need, about when you can start writing your brand applications with text, and there's just multiple things we should be working out right now. Right. So with that, I really thank you all, and a special thanks again to Andy and Zoe.